Welcome back to Mental Health Matters. We got another fantastic show today. Adam, the famous Adam, is back with me today.
Thanks for having me back, Scott.
And Adam, you're going to introduce yourself in a second, but I'm really glad you're going to be with us to talk about insurance today. So we're going to talk about insurance from our perspectives. So, Adam, you're a physical therapist, and I'm a counselor, family therapist, psychologist. And we're going to talk about people getting insurance and what does it mean and some of the basic stuff, as well as we'll get into politics for a few minutes, talking about the latest ACA.
Yeah. As Scott said, I'm a physical therapist, have a practice, and so we deal with insurance on a daily basis. Anybody in healthcare deals with insurance. It pretty much drives our businesses, really, and it's a very complicated issue. And with things coming down the line that may be changing, maybe getting worse, maybe getting better, it's really complicated and really intimidating for people that don't know how to navigate, their own insurance or even how to access it.
Absolutely. And, hearing it from two different providers' perspectives as opposed to somebody who's looking for insurance, I think is an interesting way to consider.
Yeah, because we see it from both ways. You get patients come in and they're frustrated because they have a big bill. Their insurance isn't covering what they thought it was going to cover. Yeah. And as a provider, we don't always know what even we're going to get reimbursed at that time or even if our services are going to be covered. So everybody has to do the due diligence, and it's just so complicated. It's frustrating.
It's frustrating, but we're going to try and navigate a few of the basic terms for everybody today. So you're listening to Mental Health Matters with Dr. Scott Terry. Today's show, as we said, is about insurance. So many nuances to this. But to listen to past shows, by the way, you can go to KRUU-FM, and a bunch of them are listed there. You could also go to the Ardent Center's website, so go to ardentcenter.com, and you could go to the media tab, and you could look them up and see YouTubes, which are very cool of these because they actually have like clouds or rivers or all kinds of stuff in the background. You could also listen to them as a podcast, number of different venues, and you could hear Adam in the past talk about some great topics.
Yep, we've done a couple shows.
Yeah, and Adam will be back in the future to get more into some of the nitty-gritty of this whole insurance game. But we're going to start today with just going through the basics and making sure you guys understand. And it's, again, different because, I've been a patient. I'm sure you've been a patient.
Oh, yeah. We've all used healthcare at some point in time, or the healthcare system.
Absolutely. So one is from that perspective, but also from the provider standpoint. Yeah. You guys think we're getting money. And it's not always such a simple deal.
No, yep. It's a lot more complicated than that. So if you were, let's say you were shopping for an insurance plan, first there's a lot of terminology that you even have to know. You hear the word about deductibles and high deductible plans and co-insurance and out-of-pocket maximums and your monthly premiums. All those things go into play as far as how your plan is if you're choosing a private plan. But then there's also state-sponsored plans. Most states have a Medicaid program that lower income or sometimes disabled persons can get on. And then there's the big beast, which is Medicare, which 65 and older or even some disability cases have to manage. So all those things,
and
all different components.
And of course, there's the ACA, otherwise known as Obamacare. Yes, they're the same thing. So there's some people who didn't even know that Obamacare and ACA are the exact same thing.
Right. So
it's just different names.
Yeah, I
think
it's
like they're freaked out because they hate Obama for some unknown reason.
A lot of times people were fans of the Affordable Care Act, but not Obamacare, but they didn't realize it was the same thing and really what that meant, like what did that change. And for you and me who have, maybe employer-sponsored plans or you work at a place that offers insurance, probably didn't change anything for you because you didn't have to buy a plan on the exchange other than it did make certain things, requirements. It got rid of the pre-existing condition clause, which was really difficult for people to get insurance on.
Huge. Saved my brother's life, literally, by the way. As well as mental health coverage and a whole host of other
coverage for that.
Right. So there's supposed to be mental health parity. So let's go through some of these terms. So mental health parity means, from my side as a psychologist counselor, is that if you've got regular Blue Cross and it's a current plan, you have mental health coverage at the same rate that you would for physical health.
Right.
That wasn't the case before. So, and women's health is covered. So, preventative care is covered.
A lot of preventative screenings are covered now, usually at no cost to you. We take our kids in to get their well checks, their immunizations, those are supposed to be covered by your plan.
Yeah.
So all those things that you used to have to pay for out of pocket, or they could just not cover at all, are now have to be covered. Same with physical therapy. If you have a plan, if an insurance company is presenting a plan, physical therapy has to be a covered
Really?
service. Yeah, now it doesn't cover it 100%, but it has to be involved in that plan. But then they can put other restrictions and other caps on there, but it should be a service that's accessible, just like seeing your family provider or your psychologist or psychiatrist. Those things should all be covered. So now, the question is that going to remain, or how do you know if your plan covers that, or what do you have? And you have to talk to if you have an insurance agent, or you have your plan, if you're on a state-sponsored plan, you really have to do a lot of digging to find out what's covered. You go into the hospital and you go
but you need
have something happens,
independent
and
research, not some of the website stuff, but like real research from real reputable sources. This is, facts do matter, folks, because you pay in the end. So let's go through some of the basics. And then let's get into us as providers and what comes to us.
Yeah.
So do you want to start with the providers thing or with the basics?
Yeah, some of the basics. Let's go through that. So let's say if you looked at your insurance card and you've got copays and deductibles, you wonder what the heck is that anyway. So your deductible is your cost that's going to be out of pocket that you're going to have to meet that before your insurance really kicks in at all. So people might think, oh, I'm paying for my insurance and I've got to go and have this procedure done and it costs $1,000 and you end up paying that whole part out of the pocket. And you think, well, why didn't my insurance pay any of that? Well, it's because you had a deductible. So not only are you paying your monthly premiums, but your insurance won't even actually kick in until you meet that deductible. So if you have a high deductible plan, $5,000, $2,000.
I had a $10,000 plan.
Yeah, $10,000 even at some point. If something major were to happen, you'd get in a car accident, you break an ankle, you need surgery. You better be sure that you have $5,000 or more in cash just laying around to pay that deductible, because otherwise you're not going to have any coverage until that kicks in. And a lot of people really don't have that safety net built up. So that can be kind of sticker shock, and you say, well, I thought I had insurance. Why have this huge bill? Well, that's because of your deductible. And then you have your copay or other coinsurance on top of that. So even after you meet your deductible, you still may only be covered at 80%. So then you have to make another 20%.
So explain what coinsurance is.
So coinsurance could be, if you have an insurance policy that pays 80%, like Medicare usually pays 80% of your health care. So you would be stuck for covering that other
Medicaid
20%.
Does? I thought Medicaid covers everything.
Medicaid covers 100%, but Medicare covers 80%.
Oh, I see.
So then you'd be responsible for that other 20%. Or if you had, same thing, if you had a Blue Cross or a United Healthcare plan that paid 80%, you'd still be responsible for that 20%. But you can have another coinsurance, which would be like secondary coverage. Maybe you're in the military, or you can buy a separate plan. That'll pick up that other 20%. But again, it's an additional probably monthly fee that you may not be aware of. So if you only had 20%...
Once you meet your deductible, you still could have coinsurance.
Right.
So
you could still pay a lot more.
I have a $2,000 deductible. So now I've met that deductible, but the next $4,000 or $2,000 might be coinsurance, and that might be, let's say, 50-50 or 80-20. So you still could have some responsibility.
So there's another big outlay until you reach what's called your out-of-pocket max. And the out-of-pocket max is supposedly the maximum amount you would have to pay out of your own pocket before you covered at 100%. So that could be $10,000, could be $15,000, could be $5,000. Generally, it's a higher number, but you're still expected to pay up to that amount, but you're paying a lower charge each time. You're paying that 20%, so it's going to take a little bit longer to reach that up unless you have some catastrophic accident or surgery. So then you're still paying out of pocket, plus you're still meeting your monthly premiums until you hit that 10,000 mark. Then you should be covered at 100%. But people don't always realize that. They don't know what qualifies as coinsurance, or you don't know what goes towards your deductible, what goes towards your out-of-pocket max. It's not always the same, and it's very confusing. And we see that in our practice, where someone comes in and we think that they might just have their copay. Well, their copay may not pick in until they've met up their deductible, and they don't realize that. And I don't always have that information available to me either. And there's always lapses in billing, and so it's just really complicated to find that out. But knowing kind of what your basics, what you're working with, really helps, because then you can think, if you've met your deductible, that's when your health insurance is going to be a little bit less. So you might seek out other services or have elective surgeries done after you've met that, because you know that you're going to be paying a less amount.
Like I had a hernia operation once I knew that I met my deductible and co-insurance.
Right.
You know, and so, and actually it allowed me to do physical therapy, which is a great thing.
Right.
With a great physical therapist.
And
which makes a difference, by the way, everyone.
And that's what I kind of tell people too is, when you've met that deductible and you've had something going on, seek out those services. But those are services that you might also not seek out. You might think, I need to do some physical therapy. I need to see the chiropractor, or, you want to seek out some, you need to see a psychologist, counselors or something. But, that costs money. And if you know that every time that you go and see somebody, you're going to have to shell out, $100 or more, whatever, a couple times a week, forever long, you might be reluctant to get the treatment and those services that you need early on. Or if you're going to have something checked on, you need an x-ray, well, that's going to cost money. So you might, be a little tentative about going in, and then problems can get worse. And so now, instead of being able to access healthcare, in an affordable manner, now you've kind of put this off, and it may become a catastrophic bill at some point in time.
Well, and that's really what everybody needs to think. So sometimes we avoid the small stuff because it's going to cost us. Mm-hmm. So we avoid... I know in physical therapy, people avoid going in, and then all of a sudden they've got really something major happen because they didn't prevent the problem.
So then maybe they need surgery, so you turn maybe a couple $100 bill into a couple $1,000 bill, maybe just by not accessing it.
Or in my world, like I'm going to avoid going to couples counseling because, that's scary.
Yeah.
Well, you know what? Divorces cost a whole lot more.
Exactly. So you got to do the preventative stuff, and that's what I think is part of the ACA, was trying to get some of that preventative stuff covered. Like screenings, like cancer screenings and mammograms. You keep putting that off because it is an expense, and not everybody has the money to pay that out of pocket. But if it can be covered, people can be more able to access it more easily, and then you're going to prevent those long-term problems from showing up, basically, hopefully.
Yeah. Well, and by the way, co-pays are also interesting because sometimes you have no copay, and sometimes it's $10, $20, and sometimes it's considered a specialty. So you could have $20 to see your physician, but $40 to see me as a therapist. Right. And so it could range.
Yeah, and you may not know that either going in ahead of time. What's considered a specialist? One insurance company might classify it as a specialist, otherwise not. And you may not know ahead of time, or that might even apply. You may still apply towards that whole deductible. So it's always best to ask questions, but you could call a clinic, you could call us and say, well, hey, what's my insurance going to cover? And a lot of times I can't even tell you because we haven't ran it, we don't know. We can call and see what your plan details cover, but it's not always clear cut from the little web page we get. Or you call the hospital and say, hey, I need to have an MRI. How much is that going to cost? Well, they can tell you how much they charge maybe, but they can't tell you how much really it's going to cost. So if you don't know, you might be stuck paying that whole cost out of pocket before anything kicks in. So it's just not very transparent, basically.
Well, I think this brings up this other interesting question about us as providers on the back end, which people don't normally know about.
Yeah.
And so on the back end, you hear this kind of stuff. I can't tell you how many people call me and say, well, what will it cost me per session? And I'm like, I have no idea. Well, it's a Blue Cross PPO. It's the best plan. I'm like, that doesn't mean anything.
Right.
It's really what your insurance company negotiated with your employer or your broker. And it's all over the map.
Yeah, I kind of explain insurance to people like this because it's such a unique industry that if you had 5 people going to the grocery store and they all had grocery carts full of the exact same items, and as they went through the checkout line, they all paid a different price. That's kind of what it is. And it just maybe because you were wearing a blue jacket and some guy was wearing a red shirt. That's kind of how arbitrary some of this pricing is because it doesn't really, it's just what's negotiated rate. So you don't even know ahead of time what's going to be until you go to the checkout line. Yeah. So you get stuck. And that's, medical debt is like the leading cause of bankruptcy in the U.S.
Yeah. And it happened to me. I mean, I had a major accident.
Yeah.
Hundreds of thousands of dollars in debt.
Yep. And you can't not have insurance anymore.
And you can't not pay some of it.
Yeah.
By the way, you're listening to Mental Health Matters. Dr. Scott Terry, today with us, the famous Adam. These programs are recorded, KRUU, ardencenter.com, and you could look under Media tab. The other place is you could listen in live at 6:30 on Tuesdays, 12:30 on Thursdays. Send us an email. You'll see my email at Arden Center. Send me an email and stay in touch.
Yeah.
So, Adam, by the way, tell them about you
Yeah.
for just 10 seconds, because I don't think they got where you work and what you do. 'Cause
I-
you're not just a
yeah.
regular guy who does stuff.
No, I just kind of hang out and do radio shows. I'm a doctor of physical therapy with a clinic in Fairfield, Iowa. Universal Therapy Group is our practice here. So we deal with a lot of, like we were talking about, a lot of issues, orthopedic issues, sports injuries, post-surgical stuff, low back pain, neck pain, all kind of sorts of general musculoskeletal disorders, neurological disorders. But so our industry is so tied to insurance that you can't operate really without it. And
Well,
so,
mine too.
Yeah.
I mean, people in the therapy world, in the counseling world, whatever, will sit there and say, I don't want to deal with insurance because it's such a problem.
Mm-hmm.
Or I only want to deal with certain insurance providers. So let's get back to that side.
Mm-hmm.
So, as a provider, some places really restrict.
Yeah.
Like, for instance, we don't do Medicare. Medicare. We don't do Medicare. We do Medicaid.
Yeah.
But we're on most of the insurance panels, and then there's EAPs, which we'll talk about in a second. That's a whole another ball of wax. But there's, not everybody takes every plan, nor would they want to.
Right, and you
because it's
can
a
get
pain in the butt.
I hear stories about this too, where you went to go have a knee replacement done, and you knew that you were going to get this bill or whatever from your hospital. Your hospital's in the network. Okay, good, you get a discount. The surgeon's in your network. Okay, you get a discount. Oh, but guess what? That anesthesiologist, who's a different company contracted, he wasn't in your network. Now you don't get a discount, and now you have a even huge, a larger bill that you were completely unaware of because you didn't go down the whole line and ask, and they really won't tell you, or they can't tell you if you called and said, well, is everybody in my network? Well, that's kind of on you, and how do you figure that out? It's virtually
when I
impossible.
had my accident a decade ago, I was unconscious, literally. An ambulance picks me up. The ambulance was not in the network.
Right,
And
yes.
then it's true, the anesthesiologist wasn't in the network, even though he's at a hospital that is in the network.
Exactly.
And it's just like, what the heck is going on here?
Yeah, it's so confusing. And how does, average Joe know that? They don't.
No.
They don't. You can't not know. You can't say, oh, well, I'm going to, definitely just don't do the anesthesia then, or, take me somewhere else when it's life-threatening,
so
or
tell me, Adam, why
bring somebody
would
else. But,
somebody not want to, a provider, not take insurance?
well, a lot of times the reimbursement rates might be so low that it's not, you can't afford to take it, where you would be losing money really, because you have to, think about insurance and what it costs to run a hospital or a clinic. Well, you're still paying to keep the lights on. You're paying to provide health insurance for your employees. You're paying your taxes. You're paying your liability insurance. So all those things come into play where you have to, make money to stay in business. And some plans want to just restrict you enough that they're going to tell you, this is how much we'll pay you. Will you take it or not? And sometimes you can't afford to take it. It's just too low. And when you have these big companies that tell you, too bad, you can't contract a higher rate. This is what we pay you. You either take it or you don't, which is really frustrating because then you really have no control. And
you're trying
it can
to
limit
help people.
Exactly.
Literally,
And
their
you're trying to
lives.
help people, and you're not trying to just get rich off of scamming insurances. You're trying to help people, but you need to be able to keep your lights on while you're doing it. And so when insurance companies don't want to pay for services or pay what those services actually cost, it's difficult. Some providers, a lot of providers in the areas have stopped taking certain insurances because they don't cover their cost. If you could choose between insurance A that's going to pay me twice as much as insurance B, well, you're going to really prioritize seeing insurance A patients, and you might kick insurance B aside. And so where are they going to go for coverage?
That's right. But, as a provider, what's also interesting, I had a woman very upset the other day, and she's going, you're getting all this money, and like they really think I'm getting rich.
Yeah.
And it's just like, no, first, it's playing the lottery. And that's kind of how I think
kind
of
of
it.
is. Kind of is.
Like, somebody comes in, and let's say they have a Blue Cross plan or whatever plan. Maybe I'll get this amount. Maybe I'll get that amount.
Yeah.
I don't know. Second thing is, in my world, I don't know if I'm actually ever going to get paid half the time.
Yeah.
because of a whole host of reasons.
Mm-hmm.
A lot of companies want to actually literally deny everything.
Yep, denials of care for even services that are deemed medically necessary.
That's right.
Yep.
And so I might have to go through, yes, I'm seeing you for that hour or 45 minutes or whatever, but I might literally have to spend 2 or 3 times more just dealing with insurance companies and other kinds of paperwork.
Right.
To bill that,
to document it, to support it, to show that it's needed. So, they can deny it, and then you have to appeal it or have the patient appeal it, and they don't always want to do that. So then you're kind of stuck. I mean, in medical, a lot of medical debt is written off too, like bad debt, because it didn't get paid, and you can't just always ask patients to cover that. I mean, they can't always cover it.
Well, you're on Medicaid, you can't.
Right, and on Medicaid and Medicare, things like that, you can't. It's kind of like you said. It's kind of the lottery is. I hope we get paid for this today. And some you will, some you might not, but. Some random weird little clause in some insurance company, they said, oh, well, this has to be done and prior authorized, and who knows until after the fact. It's just...
I mean, I don't know about you, but, I got my doctorate in this and postdoc and on and on and on. Never once have I had a course in this.
No.
Never once did somebody warn me that most of my time and effort goes on the back end.
Right.
And so you think, okay, I'm providing that service. I'm physically there. I'm helping you. And I want to help you so desperately.
Yeah.
But it's not so simple.
There's a lot more burden on the documentation, the insurance, the billing side. They don't realize really what goes on behind the scenes, where you might have one provider providing care and 3 people billing and scheduling and coding that care just to get reimbursed. And a lot of people see these what's called an explanation of benefits, which your insurance company sends you whenever you use your insurance. They'll send you a list that says what was charged and what was actually paid by your insurance plan. And you'll see that a lot of times what gets billed and what gets paid, what gets reimbursed to the provider, is about half of what is even charged. So you might charge, a hospital might charge $4,000 for an MRI, and they're getting paid $1,200 out of that. Or you might have a $200 visit and they pay you $60. So again,
but like for instance, as a provider,
yeah.
I always have to bill at a higher rate.
Yeah, it's just to get paid half of what you think,
half
what your service actually costs.
Sometimes it's a quarter, literally a quarter of my rates
of what is actually.
So life is not so simple on the back end. And so again, as a consumer, you need to be informed from real facts, real understanding, and sadly, you really need to know what you're looking into. And so when we get into like the new healthcare plans, you really need to get not lost in this politics and some politician saying, oh, this is great, or this is whatever.
Really look into what it's going to do for you and see where you fall in those brackets and what is going to happen with your insurance. If you're on a state plan, are you going to continue to get coverage? Are you on Medicare? Are you going to continue to get the services, see the doctors that you want to see? Are you on a private plan? Are you a small business owner? Have your own insurance? What are you going to be able to afford? What is going to happen? Are your premiums going to go down? They haven't gone down in the last 10 or 15 years. They go up every year. So how do we really keep it affordable? Or, you got to look and see what's really going to be the bottom line here. But it's just a lot to have to keep track of. And unless you have, PhD in statistics and research and all that, it's hard to figure out. And you see all this stuff coming out and 5 different, think tanks and websites are looking at it and hashing it over and finding out what is actually going to be in there, but nobody really knows.
Yeah, absolutely. So let's get into a little bit about this. And again, we'll talk more. Again, please email us and we'll go through some of the questions at our next insurance one, because we'll be doing a follow-up to this, especially as ACA gets shifted over. But what's been proposed so far is quite nasty to a lot of people, and a lot of people are upset, and you'd be upset as well. So, there's a number of groups that are very much against what's going on. There's some that are very much in support of it, mostly some insurance companies and some wealthier people who will make out better on this. But if you're poor or in need or have special needs, you are not going to make better on this deal. And so it's important to not just stick your head in the sand and go, oh, wow, I guess I'm getting screwed, but to actually stay involved, call your politicians, and make a ruckus.
Well, and states are really getting involved, too, because this is going to remake the federal funding is going to change how states get paid to run their plans. So if you're on a state-sponsored plan, like the Medicaid plans, that might change drastically, as it did here in Iowa when we privatized our insurance plans. That changed drastically what people were able to do and what providers were able to get reimbursed and bill for and treat for. So all that stuff comes down the line, and it really trickles down, but it starts at the top. So those are the highest earning levels that are kind of on these Cadillac plans. You're pretty well covered when you can, afford whatever care you kind of need. But when you really struggle to make those payments and you don't have that, $10,000 maybe cushion just for medical care, that's really what can become hazardous here.
Like for instance, one of the things is to expand HSA kind of notions, and HSA health savings accounts are okay. They're useful, and you could save some money on them. But it's only useful if you actually have a job making money and can actually save something. Yeah. But if you have a major disaster, you're in big trouble, because I don't know about you, but I don't have $10,000 sitting in a bank account.
Most health savings accounts, I think it's pre-tax dollars get put in there, so you don't have to pay tax on it. It's tax deductible or it's tax-free, but you have to use it on health care. But most people will have maybe $500. Your employer might put a few $500 on for it, and you're responsible yourself for putting money in there. But if you had to choose between saving money for a retirement or putting money on a health savings account that you may or may not use, and that money is not going to grow, you're probably going to put that money into your retirement account, or pay for your kids to have braces, or something like that. So you don't always save, right?
From day to day, week to week, and you don't have that much extra. It's not going in there. Right.
So then really it becomes on the individual, on the working class, that gets taxed the most, really. So
yeah. So the bottom line, though, is, as we say, not just stay informed, but make a ruckus, do something about being informed.
Yeah, be active. Call your politicians. They may not always respond the way you like, but at least you're getting heard. Send an email to your representatives, because they want their constituents to be covered. Everybody that has an interest in health care wants people to be covered, because when fewer people are covered and fewer people have insurance, health insurance gets more expensive for everybody, not just the uninsured. It gets more expensive for everybody. There's some stats on the increases of health spending, and it's 5-7% a year, with our GDP raising 1% a year. So the growth on healthcare expense and expenditure outgrows inflation, which has been very low. So you'll get that 1.5% salary increase, but your Medicare or your insurance premiums went up 25%. That doesn't quite even out. So it's good. I think we're in for a bumpy ride.
It's in for a bumpy ride, but again, the point of this show is to say to everybody, wake up.
Yeah.
I know we're sort of going around a million different points here. There's so much to cover that obviously we can't really get into any depth on such a short show. But the main point here is everybody wake up, regardless of what side you're on, who you voted for. If you didn't vote, you did vote. You're in a march, you're not in a march. But to wake up and say, something's got to change. And this changes from some of this other stuff is not good, both in the state, really bad within the state.
Yeah, this isn't just going to affect a couple people. This is going to affect really everybody.
Absolutely. So wake up, everybody. It's time to act. Take a pill of anger and say, okay, now I'm going to do something with it. So just like with any concern you have, the question isn't what's the problem. The question is, what am I going to do about it? Yeah. I don't care if you're having relationship issues or if you're depressed. The question isn't, how bad am I depressed and what does it feel like? The question is, what can I create from this experience to make life better for me and everyone around me?
Empower yourself. That's what I like to say.
Thank you, Adam.
Thanks for having me, Scott.
Bye.